All right. I know we're a few minutes early, so I'll do kind of like the opening act. There's been a change in your program, at least your printed program. I am not Alan Jacobson, our Chief Data Officer. Alan's a great guy. Sorry you miss him, but you get me instead. So just a quick show of hands. Who here works for a state public health agency? Medicaid, okay, cool. Others are working on the private sector, I assume. So awesome. I know you guys are from Arizona. Where are you from? Minnesota, awesome. Love Minnesota. Land of 10,000 lakes. Right? Where?
You're looking for track 5?
Where? Wisconsin. Awesome. Cool. And over here? Connecticut, New England. I'm from New England myself. I'm just north of you guys in Massachusetts. So awesome. And over here? Utah. Awesome. You get people from the West, from the Midwest, from the Northeast. Awesome. So, I miss anyone?
Yeah, over here, right?
Where? You're from Austin? So with the state of Texas? Awesome. Yeah, I love Austin. Austin's a great city. Cool. So we're about 1 minute out. We'll get, I miss anyone else? Okay, cool. Well, let me just ask, anyone here heard of Alteryx? You've heard of it. Okay, so we've got a fresh audience. Awesome. So just make sure the guys back there are all set to go. Give it one more minute.
Track 5? Need help? Do I need any help? See it. Yeah, we either got to sing or I got to scan you. One of you.
Come on in, join us. Plenty of seats up front. I do tend to wander a little bit, so hopefully that's not too distracting. But they told me I had to make sure I speak into the mic clearly. So feel free, we're a small, intimate gathering here. So if you have any questions, raise your hand, or if something's not clear, please just raise your hand and we'll go through this. Mr. Camera Person, are we all set back there? We're all set? Okay. I'm going to give it, it's 10 o'clock, so I'm, to be respectful of your time, we'll get started. So good morning, everyone. Hope you're all well. It's great to see everyone here at the State Health IT Connect Conference or Summit. I've been here for a couple of these myself. My name is Andy MacIsaac. I'm the Solutions Marketing Director for the public sector at Alteryx. And if you've never heard of Alteryx, we're an analytics platform company. We believe in the power of analytics and enabling every data user to get the data and get the insights that they need to make decisions, whether they're a data scientist, whether they're a line of business worker, caseworker, program manager. It's all about being able to get insights from data and be able to leverage that data, in this case, for public health, for Medicaid programs and so forth, really so you can better deliver on your mission outcomes, or your mission to deliver services to the people in your communities, in your states, and to your stakeholders. So we believe in the process of analytics for all. Analytics should not be the sole domain of the classically trained data scientist, and we'll talk a little bit about that. But really what I'm talking about today, and we'll reference some specific use cases, one use case in particular, are how we're helping agencies accelerate outcomes for the people and communities that they serve with insights. So if you're in public health, if you're in Medicaid, if you're in one of the other programs like SNAP or TANF or whatever, data's the heart and soul of your business. And data enables you to do a lot of things. Data and analytics are the foundations of digital technology, and they're necessary for organizations of every type, whether in the public sector or the private sector, to build resiliency and really to build capabilities to not only deliver services, but form those services, plan for the future, and get insight. And everyone within your organization should be leveraging data, or wanting to leverage data to better execute on their specific missions or tasks. But what we're seeing it's not new news, right? But organizations of every type are investing in data and analytics capabilities and in AI and so forth. According to a study from New Vantage Partners, 92% of business organizations, and that includes public sector organizations as well, have invested heavily in data and analytics, yet there's a gap, right? Only 19% of those organizations say, hey, we're investing in data and analytics, would really call themselves truly data-driven. And that gap is continuing to widen, and we want to understand why that is. So the International Institute of Analytics has come out with the analytic maturity model. And what they've done is they've collected input from over 10,000 organizations who say that we're practicing analytics. And they've looked at, okay, let's evaluate where you are around this analytic maturity curve. And so this analytic maturity curve can go anywhere from being an analytic beginner, we're not data-driven, to somebody who's an analytic competitor who has all the data and insight and analytics they need in order to achieve their mission outcomes. But what they found out is that most organizations, when they do that self-assessment, and anyone here in this room can do the self-assessment for their organization. You can go to alteryx.com and you can search the analytic maturity model. You can actually do this assessment yourself. They found out of all these thousands of organizations who have done that, they only score about 2.2% on a 5-point scale, meaning they can do localized analytics. And what that means is they're probably doing mostly spreadsheets. So let me ask you a question. How many people here use spreadsheets in what they do? A few hands going up, okay? Check. So obviously there's a lot. So they can do localized analytics, right? But the problem there with spreadsheets, well, spreadsheets are great at calculations, and it's a 30-year-old desktop technology, right? Not great at doing analytics. It's very manual and also very error-prone, because how many people here have had to combine data in one spreadsheet to data in another spreadsheet and use the cut and paste function? Well, what happens if you paste a particular column, or you miss a whole row of data? Well, your analytics is not going to be complete. Worse yet, it could be false. So we got to watch out for that. So what's really happening in most organizations is this. The average analytical process requires about 6 inputs. I need 6 sources of data, 6 different sources of data. I need to access 6 different data silos in order to get the information that I need to do my analysis. In order to do that, I'm going to have to use about 4 to 7 different analytic tools to improve or to really execute that analytic process. That could be a spreadsheet, that could be a legacy-based system, it could be a PDF report. All valuable sources of data, but it's a very manual process for me to actually then go do the analytics. And now I've got to do 4 to 7 different tools. I mean, I got to log into four different systems. I got to make sure I have access. Maybe I don't have access to all the systems I need. Now I got to go and engage, my data team to go and do that. My chief data scientist, my analytics leader to go and just run a basic report. Worse yet, I'm going to have to do this next week. Do the same thing. Waste 7 to 8 hours a week just doing a manual analytic process to get all the information I need, utilize all these different tools to put that data together, and then my boss is going to want the report in one format. Somebody else is going to want another format. Maybe it's a Tableau dashboard, maybe it's a spreadsheet, maybe it's a PDF report. So there's 7 different outputs now that I'm going to need to manage in order to share those insights across my organization. Very manual, very cumbersome, and really creates that analytic gap. The other thing that's creating that analytic gap is this growing digital divide, right? First of all, to say data scientists are important people. They're highly trained, right? They know how to code. They can do R. They can do Python. They're great people, right? Well, you can't do high-level analytics without them. But you also need them to do some of the more manual tasks, the more lower-level analytics. While they're great people, there's not enough of them, right? And in the public sector, you're competing against the private sector for these highly trained individuals, right? And we know how that goes, right? So you have your experts, the people who know how to code, great people and so forth, but what they tend to lack is really domain expertise. They don't know necessarily the business. They don't know the programs that you run necessarily. They don't know the questions that need to be answered or the challenges that are being faced as you're trying to deliver services out to your constituency, right? So when you have an analytic question, right, whether, what are our program projection enrollment numbers for next week? What is going to happen, when we have to execute the unwinding process, right? They're not necessarily going to know all those challenges, right, that you face as business people or as business leaders for those particular operations. So there's that divide, right? How do you take their ability to do high-level analytics and combine that with the actual practical day-to-day need of the individual practitioner or the data worker? And what we're seeing is this artificial divide is happening in organizations across the country, across the world, in both the private and public sector. What we need to do is find a way to get away from this, right? The typical analytic approach, right? Most data is siloed, right? It's going to require access to at least four different systems to get the data that you need. 90% of organizations are still very manual in their analytic processes. That means they're relying on spreadsheets. Again, a 30-year-old desktop technology, right? And then how many people here are in their analytic processes are able to leverage unstructured data? Does anyone know, can anyone give me an example of what unstructured data is? Anyone? Okay. Well, I'll give you one. PDF report. Yep, PDFs are great, right? You probably have PDFs going back 10 years, 20 years, right? Probably some great insight in them, but you're unable to leverage them because it's not in a structured format. It's what we would call unstructured data. And 63% of organizations only leverage structured data. But maybe that data is valuable, right? Case in point, you go back, we work with NASA. The big thing now in rocket technology is the self-landing rocket, right? Well, and we've seen it work, right? But NASA experimented with that when they were first, launching the Mercury program. Gathered a lot of data of what worked and what didn't work. Well, that data was then stored away. It's in some sort of written report. When now they're trying to obviously rebuild that capability, well, they want to go back and look at that data. How can they leverage that unstructured data? Well, with the help of Alteryx, they're now able to leverage that. We have a capability to actually ingest textual-based data through natural language processing and understand, and actually pull the insights out of that PDF report or that written report. We can pull data out of video and audio files as well. Those are all examples of unstructured data. But only 63% of organizations are leveraging structured data only, and that's creating an analytic gap. And then going back to the classically trained data scientists, right? 93% of organizations have underutilized talent. And what we mean by that is analytics becomes the sole domain of the classically trained data scientists, so those who know how to code and actually do the analytics. That's going to change because what happens is, you're only leveraging, a small portion of your talent, and you're cutting out the people who have the domain expertise, the passion, and the creativity, and know the business challenges, know the questions to ask, know the data that needs to be leveraged. So we got to change that, right? Because what we want to get to is an end-to-end analytic process where it's unified from everything from prep and blend to data enrichment, to natural language processing, to AI, and to ML. We want to automate those processes. We need to move away from doing the manual cut and paste of a spreadsheet because my boss needs that report that I need to produce every week. How do we automate that process and implement automation more throughout the analytic life chain? We need to be able to enable organizations to leverage both structured and unstructured data. And we want to make analytics available to all personas, regardless of their technical acumen, because we want to leverage their domain expertise. So we want to get away from the error-prone, insecure, slow insights process, right? You shouldn't have to spend 5 to 7 hours every week doing a manual report when you can automate that, right? And you can expand upon that. You want to get to real-time, automated, and accurate insights so you can make the biggest contributions to your agency's specific missions. At Alteryx, we call this analytics for all, right? Our goal is to make analytics easy for everyone to leverage. Regardless of their technical acumen, we want to be able to execute every analytic task in minutes or hours, not in days and weeks. We want to be able to cover everything from insights and actions across every data type and every source, regardless of what format the data is in, whether it's in a spreadsheet, whether it's in a cloud, whether it's in a data lake, whether it's in a legacy system. We want to be able to leverage that data and pull that data in to better increase our analytic capability. We want to be everywhere. And what I mean by that is insights across hundreds of different use cases, right? Whether it's looking at program enrollment numbers, whether it's tackling the challenges around unwinding, whether it's eligibility determination, whether it's fraud investigation, right? Those are all analytic capabilities or analytic use cases. And we want to be able to do that whether it's on-prem, in the cloud, or in a hybrid environment. And I think most importantly, we call this analytics for all. We want to be able to enable everyone, right? Everyone brings a level of skill and talent and passion and creativity to the table. How do we leverage that from an analytics perspective, right? So what we try to do is we democratize the analytic approach across organizations so everyone can participate in that process and really work to make analytics a team sport. The Alteryx platform, really, and I'm not going to go in depth on this, but we can ingest data from every type, whether it's in the cloud, whether it's a data warehouse, a legacy-based system, a spreadsheet, a PDF, that's all data. We can ingest that data, we're data agnostic. But really, the key is that you're leveraging one unified platform to do all the things that you need to do from an analytics perspective. Everything from ETL to data prep and blend, to enriching that data with demographic insight, to geospatial. You can do all of that in the Alteryx platform. And you can automate all those capabilities. You build that workflow once, you never have to build it again. You can always tweak it, but you don't have to build it again. You're not spending 5 to 7 hours every work week just trying to rebuild a report. So we also can add data science and auto ML. Even if you don't know how to code, you can add that to your analytic approach. You can do predictive analytics in the Alteryx platform. And then you can create those insights and export those insights automatically to a number of reporting and visualization platforms, to Tableau. We're like peanut butter and jelly when it comes to Tableau. Tableau is a fantastic visualization platform. Not great for doing core analytics, but great for visualization, helping tell the story around data. But we also work with we work with Power BI, we work with SAP. We can export the insights to going back to the 7 different reporting types that that your bosses are looking for. Alteryx can do that, and we can do that all on-prem, hybrid, and in the cloud. But let's talk a little bit about outcomes, right? Because at the end of the day, it's all about outcomes, right? It's great that we can do all these things, but what does that actually mean? Well, here's a couple of private sector examples, and I think you probably recognize most of those logos up there. Delta, at the height of the pandemic, obviously airlines were under a real economic crunch. What Delta was looking at, we need to do a better job of making sure that we can schedule our preventive maintenance, and obviously preventive maintenance is very important. We want to keep planes in the sky where they belong, but they have to go through periodic maintenance. How do we make sure that we can schedule appropriately when our technicians are available, when the parts are available, when the planes are available? How do we make sure that everything is lined up? Our supply chain is lined up, our people are lined up, the actual equipment is lined up, so we can do the preventive maintenance that we need to do. So they worked with Alteryx to look at their nationwide preventive maintenance capability to make sure that they could automate that process and look and predict and schedule, to make sure that everything would be optimized. The plane was where it needed to be, the parts were there, and the technicians with the right skills who were qualified, according to the FAA, to repair that particular part were there on site at the right time to do what they needed to do. And they estimated they were able to save about $5 million in operating costs by implementing this analytic automation process. The next one is Aetna, right? Aetna provides, has got 22 million subscribers in their health insurance division. Obviously, they're a customer service organization. What they wanted to do is they wanted to look at, looking at proactive outreach to their subscribers, identifying who might need a particular service or a particular piece of information. Hey, we noticed you moved, or you did a change of address. Did you know that these providers are now closer to you, or these are the providers that you might want to look up and go and enroll with? A number of different things. So what they wanted to do is get better at predicting what the needs of their customers were and then doing proactive outreach to them. Getting that kind of 360-degree view of their subscriber and anticipating what their needs might be so they can go ahead and do that proactive outreach. And we're going to talk a little bit more about that proactive outreach in a minute, and more in a public sector environment. And this one I love. I grew up a New England sports fan. Go Patriots, go Celtics, go Bruins, go Red Sox. Boo me if you must. But never really a big racing fan, right? I mean, I knew about IndyCar and I knew NASCAR and things like that. But man, I tell you, when we started working with the folks in McLaren, they make these super sports cars. They're based in England. They also have a racing team, just like Mercedes and just like Ferrari and things like that, all the big sports car names that you can think of. Racing is really, it's a sport, but man, it's really a science challenge, right? It's an experimentation challenge. It's a testing challenge. A lot of data goes into this. Now, in the average, F1 race car, there are 100,000 components, and 88% of those components get changed out every race season. There's a lot of data that goes into that, right? A lot of data, right? Not only race day data, but all the experiments, all the field tests, all the wind tunnel tests, all that stuff, right? It's all to gain that competitive advantage. If I can make my race car, 1 millisecond faster, that's the difference between winning and losing, right? A lot of data. 30 million race simulations are run by the McLaren race team, all powered by Alteryx, to give them insight as to how to best set up the car for that particular race, based on the weather, based on the track conditions, based on the humidity, based on a number of different things, right? That's a lot of power that we're able to put into the hands, right? It's not a data scientist we're putting into the hands of the mechanic who has to change out the tires. So they know that after 7 laps, we got to change the tires because the analytics, based on our tests that we ran, the 30 million simulations that we just ran, that's going to be the best time for us to change the tire. That's really impactful. So these are all great public sector stories, and we work with thousands and thousands of private sector organizations. This is just a small sampling. But I want to spend a little bit of time talking about what we do in the public sector, right? So I'm talking about the first two in brief, and then because that's going to lead into, we'll go a little bit more detail on what we're doing in Ohio. But everyone remembers COVID, right? Every state, had to shut down their economy. That created some, tremendous things that were unanticipated. For instance, in the state of Florida, they averaged, pre-COVID, pre-economic shutdown, about 2,000 unemployment applications every month. System worked great. Well, what happens when that skyrocketed over a couple of weeks to 2 million applications? 2 million people applied for unemployment coverage at the height of the pandemic. Well, I know what happened in Florida and happened in some other states as well. Their system crashed. They are unable to process applications. They were unable to get people enrolled into their unemployment insurance program. You're unenrolled, you can't process your application. Guess what? You don't get the coverage. It creates a huge gap, a huge fiscal stability gap for the citizens of their state. Luckily, the chief data officer at the time, Dr. Matt McCarville, had experience with Alteryx, had taught Alteryx at Florida State University, had a couple of interns and so forth. And he said, we can try and rebuild our legacy-based system. It's going to cost some amount of time that we don't have. We need to think out of the box. So what they did, they knew they had 2 million applications just waiting to be processed. They used a combination of RPA through UiPath, Google Sheets to actually create an intake form to ingest all that application data. And then they applied Alteryx on the back end to connect all the different business processes within an unemployment system. And unemployment is typically like a Medicaid system. There are different business functions, everything from enrollment to eligibility determination to adjudication to actual payment to even fraud investigations. Right? They needed some way to connect all of that data. And they did that with Alteryx. Right? Alteryx was able to help them streamline that process and connect all that data. And also analyze what was actually happening in the system, so it wasn't done blindly. They could know almost instantaneously how many applications did we process today, how many people were deemed eligible and now are enrolled and now should be set up for payment. How many cases do we need to look at that might be suspect because of fraud? And obviously, unemployment fraud is coming back up as the federal government is now starting to look at what actually happened. But what they were able to use, utilizing Alteryx and UiPath and Google, is rebuild that system in a matter of weeks, not months, in a matter of weeks, right? And that really is the power of analytic automation. They were able to automate that process. It was Dr. McCarville and a couple of interns who were able to get that state back up in a matter of weeks to wade through those 2 million applications. Another example, kind of COVID-related, is COVID-related, but in public health, obviously, and I like to say, as much as COVID was a public health challenge, it was a huge data challenge, and still is a data challenge, right? Case in point, the county of Los Angeles, the largest urban county by population in the country, their public health department was responsible for processing the test results that came in for COVID. All the hundreds of different labs spread throughout the county would have to send in their COVID test results into the county and have those boiled up and then analyzed and reported back out to the CDC and other authorities so they could track what was actually happening. Well, the problem is when you have all these different labs doing test results, right? They all do them a little bit differently. Some do them better than others. Data may be manipulated or in the wrong field. Data may not be complete, blah, 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 blah. What was happening is typically when they got reports in pre-COVID, somebody would manually audit that data, look at the data quality and say, yep, that report meets all the requirements, all the data is where it's supposed to be, go ahead and pass it on. Oh, this report's wrong. I need to send it back. And so I need to now get on the phone or create an email and send it back to the offending lab and say, we need you to fix this, this, and this. Well, that's great when you're dealing with a small number of reports. But when the reports are coming in, and the frequency that they were coming in across 100 different labs, all LA County could do at first point was apply more people to that process. I need to reallocate people from doing this very important work to now doing this more manual work because we need to process those reports. They needed to change that process. So they reached out to Alteryx, and we have a very capable solutions engineer out in California who, if you ever have a chance to meet Christine, she's a fantastic lady, love her to death, great personal story, but she sat down with these folks, and they built an analytic automation process that allowed them to take that data coming in from all the labs and automate the evaluation, automate the audit process of that data, verify everything across all the different fields for quality and completeness. And then those that passed the test were sent on to further processing and analysis. Those that weren't, and remember, in the previous experience, the previous scenario, you had to manually write back to the lab and say, hey, here's the report. They automated that process. They automated with an automated email that said, not only was your report wrong, but here's what was wrong with it. You were missing this data, this field, this demographic information, whatever it was. They were able to automate that and build that catalog, right? Data came in, the report was analyzed, and it passed or it failed. And if it failed, an automated notification was sent back to the lab with instructions on what to fix. Think about that, right? So LA County was able to save about 4 FTEs from doing that manual work. And they could apply those people, those very capable people, back to other more high impactful tasks. Great example of analytic automation. I'm going to talk a little bit more about this next one. I'm just going to grab a quick drink here. It's getting a little dry. Any questions so far? Okay. So I'm going to talk about Ohio. Now, I love working in the public sector. I've worked in the public sector from a marketing perspective for 25 plus years, spent many years at IBM and Accenture, now at Alteryx. I love being able to tell stories about how technology was leveraged by public sector agencies to improve and accelerate their ability to execute their missions. That, for me, is the power and that's why I love the public sector, because the mission's different. It's not a financial bottom line. Yes, finances are involved in funding and all that stuff, but at the end of the day, it's really about the impact that you have on people's lives, the impact on communities and so forth. I think this story illustrates that very well. So we'll talk about it. How many people who work in public health or Medicaid or different organizations have data silos? Nobody? Oh, you got data silo back there, right? You find in most organizations data silo, right? In most, in the public health or in the Medicaid, you've got people who are enrolled in Medicaid, that's in one data silo. People who are enrolled in SNAP, maybe in another one. People who are enrolled in TANF, another one. People who are enrolled in women, infant, and children, that's another data silo, right? It's a pretty common problem, right? But how do we, especially now as we look at having to face this challenge of unwinding, right? How do we organize that data? How do we get that analysis, that cross-program analysis of what's actually happening? Who's enrolled in what? And should they be enrolled or should they not be enrolled? And, how do we identify them so we can, do the proactive outreach to the individuals and get them the services that they are most likely eligible for? Well, that was the challenge that was being faced in this particular case in the state of Ohio, right? The governor and his leadership was looking at, hey, are we doing everything we can to promote and improve our rates of infant mortality? Are we getting to everyone that we need to get to? Are we making sure that if they qualify, they're getting enrolled in the right programs? So the objective was to find low-income mothers enrolled in the Medicaid or SNAP TANF programs who are not cross-enrolled in the Women, Infant, and Children's program. Sounds pretty straightforward, right? Well, it is and it isn't in that, hey, we're faced with this challenge. We've got data and all these things. We got a Medicaid enrollment data set. We've got a SNAP TANF enrolled data set. We got a Women, Infant, and Children data set. And guess what, right? Individuals who may be cross-enrolled in all those programs may not have the same name. Maybe it's Susie Smith. Maybe it's Suzanne Smith. Maybe it's Sue Smith. Maybe Sue Smith, changed addresses and wasn't updated in one system. How do we identify Sue Smith or Susie Smith or whatever name that she's going with, right? To make sure that, we're proactively able to identify those people and outreach to them and get them enrolled. So in Alteryx, we have this capability called fuzzy matching, right? The ability, it's native, it's a tool capability in our data prep tool set where you can take information from different data sets and set the parameters for how I want to identify people. Do I want to look at, do I want to look at name? Do I want to look at name, address, phone number, or other demographic information to allow me to match up and identify the people who are enrolled in a particular program or not enrolled in a particular program. The goal here is for me to identify who's not enrolled in a particular program, who may be enrolled in some of these other programs, or are enrolled in these other programs, and make sure that they're getting access to the particular program. So what the state wanted to do is basically this. They wanted to look at our enrollment data, find those people who are probably the same person, automate that process, and create this insight as, hey, so-and-so was enrolled in Medicaid, enrolled in SNAP and TANF. Yes, they are enrolled in WIC. Great. Hey, they're not enrolled in WIC, but they most likely qualify. I need to get that information out to my local field offices, my county-based offices, the 88 counties there in the state of Ohio, and give them that information so they can do what they need to do to get people enrolled. So this is what they did. They engaged with Alteryx, with one of our partners, AVAP. State of Ohio has the Innovate Ohio platform. It's how they brand their analytic platform. It's a very capable platform made up of a number of different components, including Tableau. Alteryx is a big part of that as well. But what they were able to do using the fuzzy matching capability in Alteryx is they were able to automate that process of identifying those individuals who are enrolled in some aspects of the Medicaid program, but not enrolled in WIC. And they were able to provide that information automatically out to the agencies, the field offices, the WIC offices, so they could make that proactive contact. And that was great. It was a great first step. But something happened along the way. Typical, right? When you give people access to data, they're going to do some great creative things with it, and the people in the field offices were doing what they were supposed to do, doing that proactive outreach. But that information had to come back to the central office, the central WIC office, so that they could update and see the progress. What they were finding out is that this data is coming back, and nobody's updating the records consistently, right? Somebody's using a different column, somebody's doing this, somebody's doing some notes, things like that. They're all doing the work, they're all making the contacts and so forth, but now there's an additional manual burden put back on the central office resources because now they have to manually go through and wade through those 88 reports that come in every month, every week, and manually update that data. We need to be able to fix that. So this is what the process looked like in the first phase. We get the unenrolled information on WIC or the targeted individuals that we want to proactively outreach. We are sending out the data out to a SharePoint folder. The local field offices are going to access that data. They're doing what they need to do. They're contacting, they're emailing, they're sending letters, they're calling, then they're updating the report. This is what happened. We contacted Susie Smith. Yep, great, she's going to enroll. Here's what we did. She's starting her application, whatever the process is, right? They're sending that information back up to the central office, who now has to compile that across 88 counties, so they're getting 88 different reports. Now there's that manual process where we have to do that data pull, we have to validate or audit that data, and we have to do the overall analysis and feed a dashboard so we can update. our executives as to what's actually going on. Very manual. Great that we're able to enroll people, but we're still trapped in this manual data process. So again, Alteryx was called in to help. How can we automate this? How can we automate this process, right? We know it's working, but we need to automate. We can't have this back-end manual impact on our employees. So what they did is they utilized Alteryx to automate how they created the initial data pulls. So that, utilizing Alteryx, we've identified who's enrolled in what program or who's not enrolled. We want to get that unenrolled information, that targeted list, out to the field offices. Utilize Alteryx to create that automated report, send it out to SharePoint. We have a direct native feed into SharePoint. Then the local offices are able to do what they need to do. They perform the outreach, they document the results. Then they go and they automate the results out into SharePoint. Alteryx goes out and scrapes that data and pulls that data in. And just like what they did in LA County, they were able to automate that process. They were able to do that data automation, that data validation automatically. We know what format we need to have the data in. It's coming in. Okay, so we need to go now. We can identify and we can automate and update that data, that raw data now, to get it all consistent across all 88 counties. And then so we can pull that in, we can automate that process, and now we can share that information out to our Tableau dashboard. So again, we'll talk a little bit about the first process. So the first part of the process, each month, Ohio Department of Health prepares and sends the new referral list, and using an Alteryx workflow, which reduces the manual effort because everything is automated. We can pull the previous month's data, the new enrollment data across programs. We can cleanse and filter all that data. And again, this is all automatically. We can prep that data set so we can get the right insight that we're looking for. Those who qualify, or most likely qualify, women, infant, and children, but are not currently enrolled in the program. And then we can export those files out to the field offices. And that's all done, in a matter of minutes, rather opposed to weeks to compiling all this data manually. And then on the back end, again, that automated data validation process, again, when ODS is ready for the data input, they'll go, data's already loaded up in SharePoint, they can go and do the audit of that data. They can cleanse and reshape the data into whatever format they need for the central office reporting requirements. They can match everything up and do that match back. Okay, now, the records have changed. Not only have they changed in women, infant, and children, but they also changed in Medicaid and SNAP and TANF, right? So now we're getting that more updated information, especially as we look at things like unwinding and things like that. Hey, we got insight now across all our programs, and that information is more updated, more validated, and then we can go dedupe and export and do whatever we need to do to update that system. And Alteryx automated that process for them entirely. And then they share that information out to the Tableau dashboard. Ohio's a big user of Tableau. Anyone here use Tableau in their system? Tableau is great at visualization, right? What if you need to change something on that visualization? What if somebody else wants to see something slightly different and you need to do a different analysis? Well, Tableau may not be the best platform to do that in, right? But like I said, we work hand in glove with Tableau. We empower most of, if not all, the Ohio dashboards that they use, the Tableau's dashboards, everything from the COVID dashboards to their financial calculation dashboards. We empower that, Alteryx does. We automate that process. So when a change needs to happen on the dashboard, typically the back end is going to be Alteryx driven to make that happen. But Tableau is great for sharing that visualization, right? It's great when you can share that insight, right? When you're trying to manage to specific numbers and you want to see what's going on, whatever your business challenge is, right? And you get that clarity, that transparency. Well, Alteryx really enables that transparency to happen by working hand in glove with Tableau. Okay, so just to summarize this, it all comes about accelerating outcomes, right? There are some real technical outcomes that happen here, right? We identified the quality WIC prospects for follow-up. We enabled and gave that information out to the local field offices. Great, they have that. We removed the cumbersome manual data sharing processes, that it took so many hours to get that information from the state level out to the county level. We automated that process and removed that cumbersome process. We reduced the time it took for the local offices to get the information on who they should proactively outreach so we can get to people in a more timely manner, right? That's an impact, right? We minimize the human errors, right? Because we're automating that process now, right? Nobody intentionally wants to make an error, but sometimes errors happen, right? When you put manual systems or rely on manual systems, your probability of errors happening is greatly increased. So we reduce that, right? And we reduce the discrepancy in the data by automating the audit process, the data validation process. And so they were able to streamline that, automate that, get the information to flow from all the way from the cross-program enrollment perspective all the way out to the proactive outreach, to the update, and back into the central enrollment database across all the different platforms. There's more transparency, and there's better, there's better credence in the data, right? And most importantly, and this is what I like about you, that's all great technically, but what they were able to do in the state of Ohio, right, is they were able to identify 77,000 residents who most likely qualified for WIC who are not enrolled in the WIC program and do proactive outreach to them, expanding that social safety net for those individuals. That's the power of analytics, right? All this automation, technical stuff, that's great. But we can say, we did this, that's impactful because that's what the mission was, is to make sure that those individuals who qualified for those services, most likely eligible for those services, were at least being notified that they had that eligibility, and we're getting the additional nutritional support that they needed for their families, or at least have that capability made available to them. That's the impact of analytic automation. That's what we mean by analytics for all. So just a little bit about Alteryx. We are in the public sector. We are still a small team in the public sector, but we're growing. We have 8,200 customers globally. We're in 46% of the global 2,000. This one I really like, and if you ever go to Google Gartner Peer Insights, if you're looking at any type of technology procurement, you want to go to Gartner. You want to look and see what your peers are saying about the technology. And not just about Alteryx, but about any thing that you're looking at, or from a technology perspective. We're rated #1 in the data analytics catalog or category for Gartner Peer Insights. I think that's fantastic. It's what the peers are saying, people, actual users of the platform. Another thing about Alteryx is we are really user-driven. We have an active community approaching 400,000 people. If you have a question about Alteryx, you don't know how to use a particular tool set, or you don't know how to structure a solution, you go to the community and you pose that question, you're going to get an answer within an hour, even less. It's truly impactful. I've seen it in action, and people want to share what they've learned. And so it's very open, and people share their work. This is how I did it. This is how I configured the tool. This is how, and so forth. That sharing happens, and we have one of the strongest user communities in the analytics space. We've got 25 years experience, and we've got about 300 different employees. And I'm privileged to say I'm even more privileged because I get to work with the folks in the public sector team, and more importantly, my public sector clients. So next steps. We talked about the analytic maturity model. Go, take it. You can't embark on a journey until you know where you are, right? Go and take the analytic maturity assessment. See where you are as an organization. Are you data-driven? Are you a data novice, right? Are you an analytic beginner? Take it. It's free. What the heck, share it with the folks, your analytics teams, your CIO, your chief data officer, whatever you may have. Look at your use cases. Where am I, from an analytics perspective, where are the barriers? Where do we have these cumbersome data processes, right? That really, if we could automate these really make my job a lot easier, right? This would allow us to really impact our missions and so forth. So look at your use case. It doesn't have to be huge and intergalactic, right? It could be as simple as, how do I automate the report that I have to do every week, right? But take a look at what some of those use cases are. And you'll find you have plenty of them. It's just kind of identifying the first 2 that you want to tackle. And then reach out to us. Set up a demo. Give us a challenge, right? I talked about Christine, and she's just one example of the high caliber people that we have that work hand in glove with our clients to help them, develop the proof of concept, the workflow and so forth, and really show the power of the platform. So I encourage you to do that. I know we're at the end of the event here. We do have a booth. come by and talk to Kevin's out there. He's one of our dynamic sales engineers as well, and he can talk you through it, or Chuck, or myself, or whatever. We'd love to talk to you. You know, that there's no harm in talking and show you what we can do as far as, you know, enabling you really to experience analytics for all. So I want to say thank you very much for your time today. I'm going to open it up to see if you have any questions or if I can expand on anything. So Brandon's back there with a microphone. Ask for that. But any questions, comments, or otherwise? Or say, we really wish Alan was here, and we really don't like the Boston Red Sox or the New England Patriots. Or this year it's going to be the Bruins. Mark my words. So I know, Chuck. It's easy. So any questions? Do we have reporting tools? We feed reporting systems, and yes, you can do reports directly out of Alteryx. But yes, you can produce a PDF, you can produce a spreadsheet, you can export directly out to Tableau, Power BI. So we support virtually every reporting and visualization platform that you can think of, as well as support our own native reporting as well. Okay. Yep.
So how does Alteryx help with allowing individuals to do their own ad hoc reporting with ease? Like, can you kind of walk through that story?
Sure. Okay. Everyone's got different reporting needs. I think this is the one you were talking about, right? Like I said, we're data agnostic in that we can ingest data from all different sources, allow you to do what you need to do from an analytics perspective to data enrichment. But when it comes to reporting, how do I want to set up that report? Do I want to export that out to a PDF because somebody wants in that format, to a spreadsheet, to a Tableau dashboard, or to a Power BI visualization? All those have native connectors, right? So I can just set it up and configure and say, I want to report it out to a Tableau dashboard and export that data directly into a native Tableau format or a Power BI format, right? It's easy to use. It's a drag and drop, right? So there's actually a Tableau icon. There's a Power BI. You can drag those right into your workflow, and when you hit go, that workflow executes, does what it needs to do from a data perspective, and then if you have server, you can automate that, and you can run that report every day, every hour, whatever you need to do. So it's all basically set up to enable the user to determine how they need to do that, or their central IT office or whoever is going to set that process. But it's really easy to use. I mean, I use it. I can create a Tableau. I can create a visualization rather easily, and I'm not a data expert at all. I have a history degree, right? But we enable every user, regardless of the technical acumen. Now, people can do some really creative things if they know how to. If they want to code, they can do that too. If they want to create some custom reports, they can do that. But we have a lot of pre-baked reporting capabilities right into the platform.
Do you have any deployed use cases that involves both critical data and claims data in any of your clients?
I'm saying critical.
Do you have any deployed use cases that involves core clinical data and claims data?
Claims data?
Yeah, claims and clinical data too.
Yeah, we actually work a lot with insurance companies on claims data. We do a lot of things with claims data, both in the healthcare space, but also in the payer space as well. So there's a lot, and obviously we do a lot of stuff with the VA on claims data as well. So yeah, we'd love to talk to you more about that. So we do a lot of stuff around claims data, both in the healthcare space, in the insurance space, and also in the public health space as well. Anyone else? Okay. I know we got a few minutes left. Chuck, anything you want to add? Okay. You're all over it. All right, cool. Patriots. Yeah, and the Celtics, but I won't talk about what happened the other day. So, so anyway, thank you very much for your time. Sorry Alan couldn't be here, but please reach out, come by, see us at the booth. I think we have another hour left of that. Happy to talk to anyone one-on-one afterwards. So thank you very much for your time.